In Boston's response to the pandemic, the progress from shutdown to reopening will depend very much on testing. This can mean getting a better idea of how many people are spreading infection, even if they have no symptoms, and how to isolate them from the general public. These are among the reasons for the voluntary random testing this week by the City of Boston in collaboration with Mass General Hospital, as well as universal testing among the homeless. To tell us about the effort is the Mayor's Chief of Health and Human Services, Marty Martinez. Thank you very much for being with us, Marty.
Absolutely. Thank you for having me.
All right, start with the size of the sample in this testing, at least what you're doing with Mass General, and what you hope to learn from that.
Yeah, so the size of the antibody testing is about 1,000 people. It's a small glimpse of the population, if you will. But what we're hoping to learn in partnership with Mass General is to sort of understand a little bit more about the spread of the virus, and to understand in some key neighborhoods where the virus is spread in terms of numbers, and what that percentage might look like. In order to participate in the study, you have to be asymptomatic. And the majority of people who are being tested for the virus right now are symptomatic, given the CDC and state guidelines. So this allows us to look at a broader slice of the population and to sort of understand what we may not know in terms of how many people truly have it, and to give us a sense of what are some of the areas we need to focus on.
I know this is something you're trying to do into Friday. Do you have all the people you need already committed to this, or do you need to persuade them a bit?
Yeah, I mean, it's totally voluntary, and we've done some random outreach into the community. And so we're still pulling in folks from that random outreach that we've done. So if we reach you and we reach out to you, we hope that you'll do it. But we're still in the process of lining folks up all through this week into Friday, with the goal of getting to 1,000 people by the end of the day Friday.
Now, we've heard for several weeks now that people who don't display symptoms can still spread this virus. In Los Angeles, they did a study, and I guess their conclusion was a lot more people have this infection than we thought before. That's not too surprising either, but why is it important to know that?
Yeah, it's important to know that because for the beginning of the conversation around COVID, it's that if you have symptoms, stay home, stay away from others, isolate or quarantine yourself. But there are people who don't know they're sick. There are people who don't have any symptoms who can still be infectious. So understanding sort of the spread of that and what it looks like will give us a better sense of truly what the population looks like. And to be able to understand, it's not just those who are symptomatic. I think the CDC has said they think could be 35% of folks never have symptoms, who then have the virus and might be infectious but don't know it. So the antibody testing will allow us to look at that a little bit. Currently our infection rate in the city of Boston is about 33%. And we know that's elevated and high given who's been tested. So we really want to see what this looks like when we actually look at a broader sample. So it'll help us understand how far it's gotten in the community.
I want to look at some of the neighborhoods where you're more focused with this testing. We're talking about East Boston, parts of Dorchester and Roxbury, and also I think Rosendale. Why those areas?
Yeah, so they were all picked for different reasons, to be honest. I mean, the goal is to look at the data and help the data shape what we're trying to do. So we didn't pick necessarily just the hardest hit neighborhoods. We picked them for different purposes. So we looked at a percentage of population where the testing might be the lowest, where not enough people are getting tested. We looked at neighborhoods that had in an average level of increase of tests from week to week, so we could understand what it looks like in a neighborhood that is getting some testing, but kind of middle of the road for the city. And then we also looked at diversity around geography and as well as race and ethnicity. We wanted to make sure we could capture the true diversity that is the city of Boston, but not only race and ethnicity, but around geography, which is why we have East Boston in one corner of our city and Rosendale in the other. And again, this is just the beginning. We hope to do more antibody testing to really try to understand the full scope of the virus, as well as all the diagnostic testing that we're working on across the city. So that's why we selected the zip codes we did to start.
Well, a lot of experts are saying a lot more testing needs to be done by just about everybody. How does that help policy as far as the move toward eventual reopening?
Yeah, it's important to know that spread of the virus. I mean, to think about reopening businesses and schools and community events and things like that, you have to have an understanding of how far the virus has spread and what percentage of folks have it. If you're not testing and you have so many folks who are asymptomatic, you'll never be able to really contain the virus, if you will. So testing linked with contact tracing is a really important piece. The contact tracing, if you will, is really when someone tests positive, our public health team is able to contact that person and figure out who they've been around, who are they close to within a certain amount of time, and then reach out to those folks so that they understand the risk that they may have. It's classic public health work around infectious disease, and you have to both test a lot and trace those folks in order to really understand how to contain the virus. So we have to do both in order to be ready to loosen up some of those restrictions to sort of try to get to that next phase of beginning to think about recovery. But we have a lot of work to do.
By the way, contact tracing can be fairly labor intensive, even if temporary. I mean, looking at the scale of things required here, I mean, how are you going to make that work?
Yeah, it's hard. I mean, I think the state has done a great job with its, contact tracing work. It's collaborative work that it's doing with Partners in Health, which is great to bring on, if you will, an army of tracers who will reach folks and connect with them. And it's important that that's done in multiple languages and from a culturally confident perspective. So if someone tests positive within our diverse communities, we can support and reach into that. So for the city, we're working with the state to make sure there's enough tracers to focus on Boston. If you test a lot more, which is what our goal is and which is what we've been trying to do, you're going to have more people test positive. So in order to do that, you have to make sure you have those in place. So we're working specifically to make sure that there's the folks are there, the people power, if you will, to be able to reach everyone is there. And partnering with the state is an important part to do that. So that's what we're focused on.
One thing the administration has been working on for several weeks now also is really targeting people who've experienced homelessness. Why is that so important in the bigger picture?
Yeah, because if you think about the fact that, we've been really focused on the homeless population, but also on our most vulnerable Bostonians. I mean, Mayor Walsh and the team has been really clear that we have to focus on those who are most vulnerable, where the disease or the virus could hit a severity, which puts people in the hospital or makes people potentially succumb or die from the virus. And so on the homeless population, obviously living in a congregate living environment, in a shelter, for folks who are already facing a variety of challenges, we wanted to better understand the spread of the virus within that community and then start to isolate and take people out of our shelters so we could limit the density that was already there with people that are sharing living quarters, sharing bathrooms, and eating together. It's very easy to understand where the spread of the virus can be much quicker. So we're universally testing our homeless population. We're doing it in partnership with our important providers that are doing amazing work, including Boston Healthcare for the Homeless, who's the clinical partner here, to be able to understand the spread of the virus. Right now, I think we're seeing a rate in the mid-30s of all we've tested thus far testing positive, which is high, but not incredibly unexpected given the fact that the challenges and the living environments that people are in. But again, one other note to your earlier point, the vast majority of those folks who tested positive were asymptomatic. So they had no symptoms, they were not sick. So it definitely showed us that there's been that spread among folks who don't have symptoms, and that's why we wanted to make sure to focus on it and better understand it.
Of course, what you have seen in Boston, as well as in many other cities around the country, are racial disparities in things like infection rates. What about the response to that here in Boston?
Yeah, absolutely. From day one, we've been committed to sharing data, making it accessible, and trying to understand what we're seeing from the data. And the data has not, unfortunately and disappointingly, hasn't been incredibly surprising. We know that communities of color and low-income communities are disproportionately impacted by many of the public health challenges that we face in our community. And so that's true also for coronavirus. We've seen roughly 40% of the cases that we've seen in Boston where we have race and ethnicity. 40% of those are in the Black African American community. And we know that that's above the population of the community, which I think is roughly at 26%. So we see a disproportionate impact there. We see a disproportionate impact on the death data as well of who's most impacted. And so it's allowed us to look at the information and raise some questions that we need to answer that we're working on every day, which is why is the impact happening in these communities, and what are we doing to sort of prevent some of the issues that we're seeing, and be focused on it with an equity lens to sort of tackle these issues. So it's been really important to understand the data.
Is there anything as far as equity that you're seeing now more clearly than before? Because I can see potential for a lot of things. It could be access to healthcare, the way things are living at home. What do you see?
Yeah, no, you're right. Because what we're talking about is there are systemic inequities that exist that prevent folks from diverse communities having access to healthcare, folks from diverse communities, utilizing the emergency room as a primary care provider, if you will, which is exactly what we don't want to see happen when you have an infectious disease spreading. But there's also situations like who are our essential workers? Who's going every day to the grocery store to work? Who's still cleaning buildings? Who's still doing that layer of work that then puts people at greater risk? And who has to because of the economy and can't work from home, if you will? And what is that barrier that's still there? I think we're also seeing something that I think we don't always think about when we think about some of the disproportionate impacts. But if you live in a densely populated neighborhood, if you live in housing where you might live with extended family or others and don't have space, if you will, to isolate yourself, if you have an infection, you can infect other people in your family. And so that's a little bit of what we have seen, that in certain neighborhoods and in certain places, we are seeing multiple people in a house get infected. And so that tells us that we needed to pull on some resources up so people, if they tested positive and can't isolate at home, they have somewhere else that they can go, which is why we brought on things like Boston Hope to have access to different beds like that for people to be able to get well. So again, the systemic inequities are there, and we have to tackle them now. But as we think about recovery, we also have to focus on them so that we don't just go back to those inequities. But it's been an important conversation, and I think this task force the mayor created has really helped us try to understand it better while pushing us to make sure we don't lose sight of it.
I have looked at the map on the rates of infection in Boston, and I think aside from West Roxbury, these rates are higher in neighborhoods that have a higher percentage of young people up to age 18. So I guess that has something to do with what you said about household size.
Yeah, absolutely. It's definitely connected to the amount of people living in those neighborhoods. And I would also argue if you overlay that map on our foreign-born residents, you're going to see some correlation between some of those neighborhoods with higher rates and the neighborhoods that have higher percentages of foreign-born residents. So we also believe, although you don't capture that in the data, if you will, we also believe that some of our immigrant communities are also being hard hit and disproportionately impacted. So again, we're focused on that as well. An equity lens has to be broad. It can't just be one community. And so that's why we're really looking across the entire population.